Okay, so in this video we are going to be talking about the vertebral column, ligaments, joints, bones, categories, and then also the muscles of the back, origins, insertions, and actions. So to begin with, we are going to be using the Complete Anatomy app, where it allows us to use diagrams of the body. So our first topic is the vertebral column. The vertebral column is divided up into 4 parts. I already drew the lines on this just because when I use the pen tool, my head is all up in the camera and I don't think you want to see that. So just because I'm on my MacBook. So to get started, in the pink we have cervical. In the cervical there is 7 vertebrae. In the blue we have the thoracic, that is 12. In the orange we have lumbar, which is 5. And in the red, we have sacral, which is 4 to 5. What I learned when I first took my first anatomy class was to think of it as you have breakfast at 7, you have lunch at 12, I'm so sorry, you have dinner at 5, and then we didn't really learn anything for the bottom, just either 4 to 5. But yeah, so that's how I kind of remembered it, and it's a good way of thinking. Besides that, let me try and do all this stuff real quick. And then we are gonna kind of turn, there we go. Turn the back as a whole, just like that. As you can see, there is kind of a spine just like that, where it goes into a curvature. So there is a curvature in our spine. The spine is divided up into 4 curves. The first one is cervical lordosis. Second, thoracic kyphosis. Fourth, lumbar lordosis. And then we have the pelvic curvature. The primary curvature of the spine is kyphosis, just because we have that being developed when we are in the womb at birth. The secondary is lordosis, just because that is developing as we age and grow into adulthood. I didn't quite specify before, but there are 2 special vertebrae up here at the top. This one is atlas, and this is axis, just because they have different names in the cervical section of the spine. As for movements, so I'm so sorry for the cutoff, but there are 4 different movements allowed in the spinal cord. Some of the movements vary just because of the structure of the vertebrae and how the ligaments and joints are composed. So the 4 different movements are flexion, extension, rotation, and lateral flexion. So, for example, on why things vary, in the thoracic region, flexion and extension is limited, but mainly permits rotation, just like this. And another example is in the lumbar region, where flexion and extension is permitted, but rotation is limited. Okay, before we continue on, I would just like to describe a vertebrae just before we go into talking about vertebral joints and ligaments, just so there's a better, clearer picture of what it is. So here we have a vertebrae. I'm just going to describe it if it was a typical one. So right here we would have this spinous process. Right here is the laminate. Here is the body. You kind of can't see it just because of the angle. We have the pedicle there. We have the transverse process. Here we have the spinal canal. Here is the superior, like the articular process. And yep, that's pretty much the structure, just so you have a better idea on how it looks as we continue talking about vertebral joints, things like that. I guess here's a better view of it. So we have the spinous process, laminate, the pedicle, the transverse process right here, the body, so the spinal canal. Okay, so now we are going to be talking about vertebrae joints. there are two special joints in the vertebrae. The first one is already highlighted, as you can see, just because I don't know how my big ol' head up in there. So this is the atlanto-occipital joint. This is between the skull and C1 atlas. The movement it permits is flexion, extension, and lateral flexion of the neck and head. And this joint type is a synovial condyloid. The second special one is between here. It's kind of tough to see. Oh, no, not that. Right in there. So the second one is the atlantoaxial joint. This is between C1 atlas, C2 axis. This primary movement is rotation. So if we are looking from side to side as if we're shaking our head no, is what helps us. This joint helps us permit that movement. And the type of joint this is a synovial joint. So there are other regular joints in the body. The body and the spine. The first one is the intervertebral joint. This is between the vertebrae bodies. As you can see, you can't see just because the annulus fibrosa is right here covering it. It is a symphysis joint, and it is typically responsible for weight bearing in the spinal cord. So the second joint would be the facet or zygophobial joint. I'm so sorry if I butchered that, but that is between the articulating processes of the vertebrae, and it is synovial joint type. The third joint is the costal vertebrae, and that can be seen between the ribs and vertebrae. I'm so sorry, this is very hard to maneuver on a MacBook. But yes, they would be right here in between our vertebrae. And sorry, I attempted to find the costal vertebral joint, but it was quite difficult. But the next joint would be the sacroiliac, and that is between the sacrum and the iliac of the pelvic bone. So all joints are supported by ligaments, and this is what we're going to go into next, which are the ligaments of the vertebral column. So next we're going to go into the ligament of the vertebrae column. The first one is the longitudinal ligament right here. This is the anterior aspect of it. There's also posterior that goes from the sacral all the way down to for the occipital all the way down to the sacral. So the functions of this anterior aspect limits too much extension, and the posterior limits too much flexion. It is quite hard to see the posterior, but here is the anterior. As you can see, it goes all the way up and down the spinal column. So the next